Are you struggling with keeping your loved one out of the hospital and they have a wound? I'm here to help you. We've already had a session about avoiding hospitalization. Today we're going to do a deeper dive. Let me introduce myself. I'm Bienstock. I'm a board-certified plastic and reconstructive surgeon. My specialty is wound care in the home, and I try to keep patients in the home and avoiding hospitalizations with their wounds. So I've had many patients who have had to go to the hospital, which has been really detrimental to overall health. I really try to push, as I've discussed in a previous episode, how to avoid hospitalization. Now, this does require resources, both financial as well as manpower. A lot of my patients, when a nurse comes in, they say that the wound's infected, they say go to the hospital. A lot of times I can manage these patients in the home with either oral or intravenous antibiotics, as well as a surgical debridement. Since I'm able to perform a procedure in the home under local anesthesia, almost as successfully as would be in the OR. Since most patients who are over 80 or 90 really would not sustain a long term of general anesthesia with a surgical debridement. So I'm going to give you examples and do a deeper dive. I had a patient who had significant cellulitis of her lower extremities. She was showing signs of sepsis, and the family really refused to have their loved one go to the hospital, because every time she's been to the hospital, she goes back 5 steps. And this is very common in a lot of elderly patients who have multiple medical problems, and it's really difficult to recover from a hospitalization, even though sometimes it's needed. So in this patient, I was able to call up a special type of doctor who does emergency house calls and really deals with intravenous antibiotics. We're able to get the patients antibiotics within 6 to 8 hours, as well as lab work, which would have been just as fast if they went to the hospital. We put the patient on the right antibiotics. The patient's fever went down, their white count went down, and the cellulitis went away within 2 to 3 days, and they had a successful recovery at home, able to have the foods that they like, be able to do the wound care in the home is the same, maintain the same nurses, and have the family stay there, so there was an advocate for the patient. So this was definitely a win. Obviously it required more manpower, meaning the son as well as a grandson were involved. We were able to get a special team of doctors who puts an IV in, as well as get intravenous antibiotics and teach the family how to do this. Another example I have is a patient who I've been seeing for a year who has a pressure ulcer of the sacrum as well as the buttock and developed a significant urinary tract infection. Everyone was kind of poo-pooing. They saw cloudy urine. They didn't really address it. The patient was showing signs of altered mental status with high fevers. This patient was becoming bacteremic and septic, meaning that the bacteria was getting into the bloodstream, which was causing systemic effects as well as low blood pressure. The family did not want to send their loved one to the hospital, which obviously makes sense. The nurse who was involved, who I work with intimately, she was able to get labs done very quickly, as well as get the patient an IV and appropriate intravenous antibiotics, since the patient has had a history of urinary tract infections. And within 3 days, she significantly improved in her home and did not require any hospitalization. This required a lot of work, as well as financial resources by the family. The nurse who was very involved was on top of everything, getting the primary doctor, the whole IV team, the team that does labs to come to the house immediately. So it shows you that, once again, as I talked about, collaboration and communication is important. This was one time where it was exceeded expectations, and we were able to keep the patient home. Another patient I've been involved tangentially was dehydrated. The family called me in a panic. The patient's blood pressure was low. He was not eating or drinking, and they really wanted to avoid a hospitalization. It was one of those hot, humid days in New York City where it was 95 degrees. A lot of old people I shouldn't say old people, people who are older don't like air conditioning. The patient was obviously dehydrated. We were able to get a company in to put an IV in and give quick IV fluids. The patient was able to see 2 liters of normal saline and rebounded very quickly, did not need any hospitalization, was able to go back to his normal routine within 24 hours. So these are just 3 examples of really working together with the family, the other healthcare providers, the caregivers and nurses. Were instrumental in keeping the patient home. It isn't easy. I don't want to make this sound simple, that it's always you can keep everyone at home, but you have to really find the right group of people, specialists, as well as provide financial resources. So many of these services that are done in an emergency setting to avoid hospitalization require out-of-pocket expenses, but they can be done, and generally the loved ones do much better staying at home if we can manage them at home. If you have any questions, comments, or suggestions, please leave them below. I'd love to entertain them. And make sure you subscribe to the channel, and please share when you get a chance. I look forward to our next session. Thank you.